And I've been asked by Louise to come here today to talk to you a little bit about pain, chronic pain, and back pain. I really like to run a really informal kind of presentation. So as we go through, don't be afraid to kind of ask questions if something doesn't make sense. If you've got a problem with any of the facts that we present, then just kind of ask us. And I'm hoping to kind of run through everything within about half an hour, maybe 40 minutes, and then leave enough time for questions about what we've done, or if you guys want a little demonstration about how we work, because we work completely different to perhaps anything you will have come across before. But this is really an opportunity for me to try and figure out, based on the 20 years I've been doing this, what might be helpful for you to know, and you to try and figure out how to get that information out of me, I suppose. And so let's crack on. Any questions before we start? Nope. Cool. Alrighty, off we go. So I kind of answered that. So what we do as in our clinic in Cardiff is we want to specialize in trying to help people get out of chronic pain. Because when people are in chronic pain, there's something to know about chronic pain, which people don't really connect with. And the thing that you want to know about chronic pain is if you're in chronic pain, something has gone wrong. And that's the truth of it. Because normally what happens is if you injure yourself, like if I cut myself now, how long do we imagine that cut will take to heal? And the answer is probably about 2 or 3 weeks. And that's called intention healing in biology. If that cut then takes a little bit longer as we get older, that's normal too. But any injury that I get that lasts, that is still painful beyond about 3 to 6 months, the problem now is that the brain still thinks the area is injured and is giving you pain to try to protect you. And the reason for that is that any injury that I would have had will have already healed as well as it's ever going to heal. And so if I've hurt myself, my elbow, my back, my ankle, and I'm still in pain 2 years later, believe it or not, the thing that's gone wrong is actually the brain still thinks you're injured and giving you pain. And so we're going to get into that in quite a lot of depth today. Okay, let's dispel some common myths. Thanks, Luke. Okay, so let's suppose we have back pain, all right? There's a couple of things that we need to know about back pain. And the first thing I would say to you is, do you need a scan to diagnose you've got a problem with your back? And the answer is, like most things, maybe. And the reason why I say maybe is that you only really want to go for a scan on your back if there's a real suggestion that you might need surgery. If you don't need surgery, then the chances are the thing is going to heal of its own accord over time, if you do the right thing. And actually what's been really interesting is the pandemic that we've all been under a cloud for the last 2 or 3 years has given us really interesting data with regard to back pain and x-rays and MRI scans. And what I mean by that is that, unfortunately, just as we all entered lockdown, those people that had had MRI scans and they'd had disc problems and they were having raging sciatica, so pain down the back of the leg, and the surgeon had actually said, yep, okay, we think you need surgery. They were regrettably denied that surgery because the theatres closed, because the country was locked into pandemic and locked into lockdown. And then as the theatres reopened about, well, recently, within the last kind of 6 months or so, the secretaries for the consultants went through their list of all those people that were diagnosed with these problems to say, okay, now, Mr. Jones, we're ready for you. Do you want to come back in? And what they found is that the people that they were calling were actually saying, do you know what, it's actually feeling a lot better. And so what the evidence tells us is that if you have a back problem that's bad enough to require surgery, that the consultant says, listen, you need surgery, if you can somehow get through the horrendous pain of 3 or 4 months, probably, if you can get through that somehow, that the overwhelming evidence is the disc will tend to heal itself over time. And what's also interesting is the longitudinal data on back pain tends to suggest that the outcomes for having surgery for your back in the short term is very, very good. If you have back pain and you have the surgery, you're going to do very, very well in the short term. But the long-term outcome is actually no different if you do or don't have surgery, which is really interesting. Okay. Nope, hang on, one second. When we have back pain, we imagine that exercise is going to make it worse, or sometimes we don't know what to do, and that we think that pain always equals damage. And what I'm going to go and show you today is that actually pain does not equal damage, because that's what we think. We think, I've got pain, I've hurt my whatever it happens to be. But that's not always the case. All that's happening is that the bit that's injured maybe is releasing chemicals which then get sent up to the brain, and then the brain decides whether that's actually going to give you pain or not. So the thing that you want to get into your mind is that pain does not always equal tissue damage. And the thing with chronic pain is that we imagine that there's continuing tissue damage, and there's not. There's the fear of tissue damage which gives us the pain. Okay. So another common misconception is as we get older, we get arthritis. So what's arthritis? It's wearing of our joints. And again, that's true. They are correlated in the sense that Luke here is going to have a little less arthritis than me because I'm older than he is. But just because they're correlated, it doesn't mean they're causated. So what that means is just because you get older doesn't mean that you have to develop arthritis. And we'll talk a little bit more about what arthritis is. And just because your grandmother or your mother had arthritis, there's no genetic predisposition that we know of yet that means you're going to get arthritis. Probably the relationship is more familial and more environmental, that you know, because you grow up in a certain area, you adopt the habits, like with accent, of the people around you. And therefore, environmentally, you do the same things they do. Hello, you're right. No worries, come on in, you're very welcome. We're just talking about arthritis and that there's no correlation with arthritis, no causation with arthritis with age, but they are correlated, and we'll talk a little bit more about that. Okie dokie. Now here's a really interesting one. I'm not gonna, I'll just put myself up as being over 40, okay? So those of you that are over 40, you already have, based on the preponderance of evidence, disc damage. All of you over 40 have already got damaged discs. Live with it, don't, you know, that's a deep truth. In fact, if we look at the data, if you're 40, what's the likelihood that you already have disc damage? 68%. 68% of you have disc damage already. Okay, that's just life. Okay, it's like I looked in when my daughter brought a picture home of daddy. Picture had grey hair and a red face. Gotta just figure I'm getting older. Can't do anything about it. All right. And actually, when my son did a picture, I had a receding hairline. Well, that's life. Same as with disc problems. When you're 50, not quite there yet, but if you invite me back in a couple of years, probably will be. The chances of you having disc damage, 80%. Okay, so so what does that mean? There's a lot of nocebo fear about these things. Oh, I've got a damaged disc. Yes, you have, but then everyone else does too. And so the interesting thing is, how do we know what the pain generating structure is? Because here's the thing, say you develop back pain, never had back pain before, and then you go to get an X-ray or an MRI scan, and the MRI scan comes back and says, okay, you've got disc damage and you happen to be 50. Well, 80% of the population have disc damage. So the point is, how do you happen to know that the thing that looks worst on the X-ray or MRI scan happens to be the thing that's causing you pain? And the answer is you don't. And there was a very interesting study done by 3 eminent radiographers. So radiologists, forgive me. These are people who've done a medical degree and then spent 7 years training to actually read these X-rays. And what they did is they took 100 MRIs of people's backs. 50 of those people had back pain, 50 of those did not have back pain. And they gave those 100 MRIs to these 3 consultants. And they essentially said, okay, based on the findings alone, can you put one pile saying this person has back pain and one pile saying they don't have back pain? And what do you think happened? They didn't even get it nearly right. A chimpanzee could have gone in the dark room, thrown everything up, gone into two piles, and the chances are they could have got it as correct as they did. Because the answer is, just because you have a particular structure, degenerated or not, doesn't necessarily mean you're going to have pain with that. And you might have a really bad looking back structurally and have no pain. And then another person might have a relatively mild structural problem and have a lot of pain. The only, in fact, way you know honestly what the pain generating structure is actually if you inject like a saline solution into the structure and it then increases your symptoms. Then you can go, okay, that's definitely it. And so my point is, we are so habituated in society to try to look for a structural reason, it doesn't allow for the functional cause, the brain's interpretation of the structure to come to the fore. And I'm going to talk to you a lot more about that, because that's where the most modern understanding of pain is. Because I'll leave you with this thought. Pain is supposed to be informative. It's supposed to be helpful and informative. And so what does that mean? It means that if I put my hand in the fire, my brain receives information from my hand, and the information goes something like this: ouch, right hand, take action, pull it out the fire. Okay? And there was a disease that was sadly has been thankfully, I should say, has been eradicated over the last 200 years, which was classified by the absence of pain. And we'll all remember what that was. That was called leprosy. And so if I had leprosy, I didn't experience pain. And if I didn't experience pain, I wasn't alerted to the site of the structural injury. I wouldn't take action, and therefore I couldn't cleanse the wound or what have you, and then it get gangrenous and it fall off. So pain is supposed to be helpful and informative. So it's really important that we have pain. And it's a really, really ancient pathway. Very, very ancient in terms of neurology. Why? Because it's supposed to attract our attention. That's its job. But once I've been alerted to the fact the thing's injured and I've taken action, there's no more utility for pain. And so the thing that goes wrong in chronic pain is that the alarm is still ringing, but the fire's gone out. And so how do we turn off the alarm? That's the question. And once again, we'll just talk about arthritis just to kind of nail home this point. We often hear about people going in to the GP, perhaps with hip pain. And they probably only had hip pain, maybe getting in and out of the car, they feel it right in their groin here. And then they go to the GP says, oh, okay, we'll have a look and we'll take an X-ray. And they take an X-ray and they find that there's so much degeneration in the hip that they actually require a hip replacement. And you're like, well, how the devil has that happened? I've only had hip pain for maybe 6 weeks, maybe 2 months. And the answer to that is that degeneration, osteoarthritis, particularly in the hip, is a really glacial event. It takes a long, long, long time, 10 years probably. And so how is it that we've only experienced pain in the last maybe 2 months? And the answer to that is awareness. Because what's happening is that for the last 10 years, that patient has been walking into the wood, walking into that poor function wood. And only at the very, very end does the pain start. Because the brain's like, oh, hang on, I can't do that anymore. I need to bring awareness to the problem. By that point, it's too late in some sense. It's like, well, I don't drink alcohol, but it's like the drunk at the party. He's the last guy to turn up and then will never leave, if that makes sense. And so it's all about trying to restore function as best as you can and not think about pain. Because if you can restore function, then the brain goes, okay, well, I'm receiving lots of beautiful information from the hip. The function is good. I don't need to alert you to the fact that there's a problem anymore. Okay, so you press play, little kind of 90-second animation for you. Put the mic up here.
collapsed the disc, or sprained an ankle. Or you may have been diagnosed with chronic pain years ago. It also doesn't matter where the pain is located, be it head, stomach, neck or back, arm or leg. Most tissue structures have healed as well as they can by 3 to 6 months. After that, no more healing has to be done. If pain persists after 3 to 6 months, then tissue damage is not the main issue. Structurally, you will have healed, but your brain may still think that you are injured. Your brain still perceives the original site of the injury as a threat and is trying to protect you by acting as though it is still injured. If you recognize any of this and you are left with more questions than answers when it comes to your pain, then call us at Cardiff Pain and Performance Clinic.
Questions on that so far? Questions so far? So it's a paradigm shift, right? It's really talking about the way that, and in some sense, modern medicine is set up, is to look for the structural cause of the problem. And what we're saying to you is that any structural problem will have healed, obviously, as well as it's going to heal within a certain time frame. And so if you're still in pain, then the reason for the pain is due to more to the brain wanting you to be in pain. Now, I know what you're all thinking, because when I learned all of this, I was thinking the same thing. Am I saying it's all psychological and it's in your head? No, it's definitely not in your head. It's not psychological, meaning it's not to do with your personality. It's not to do with waking up in the morning and go, woo, we're gonna have a great day, I'm gonna have my espresso and I'm not gonna be in any pain. That will never help, because that's not the problem. The problem is the subconscious, and it's associated with, and the information the brain receives from the body has gone wrong. So you have a real problem, a real physical problem that is causing the pain. It's not a fake pain. And the other thing I would say is there's no fake pain. Okay, it's real pain. And it's not saying the pain is in your mind. It's real pain, like being stabbed in life, real pain. But the problem isn't the tissue structure. The problem is the brain is giving you pain because it believes there's real reason to do so. And we'll talk about that. Okay, questions? No, not yet. Okay, good. All righty, no worries, we'll keep trucking. Okay, okie dokie, where are we now? Okay, so how do we figure out what's going on? Really, that's the key thing, isn't it? How do we know? And so the answer is, it's a fusion of things, like everything. In order to figure out what your problem is, it can't be a one-size-fits-all thing. It has to be a complete conversation, examination of what your ingredients is in order that creates your pain. So what does that mean? Well, there could be a certain degree of structural problems. Maybe you do have a bit of arthritis, okay? Maybe in addition to that, you happen to have some dietary food intolerances, making you a little bit more pro-inflammatory. Maybe you have a little bit of a hormonal issue, maybe you're premenopausal, and that's involved in it. Maybe you're just separating from your partner. Maybe you've just had a big tax bill. All of these things play a role in determining, your brain determining how threatened you are. Because we all know, if I'm in pain and I just won the lottery, I'm probably going to experience less pain. Okay? But if I'm already late for a meeting and my child has just vomited on me and I'm just going out to the car and I've got a flat tire, my life is pretty bad at that point and I'm going to experience more pain. So pain is a fluid thing, okay, that very much depends on a bunch of factors, not just what does the MRI say. Does that make sense? Brilliant. Okay, next one. Okay, so we're going to talk a little bit about inflammation. So inflammation, if there was a cause of pain, this is what it is. It's inflammation. Okay, and we need to understand a little bit about inflammation because it's a really important topic. So if I don't know, I offended you and you stabbed me with your pen, Okay, so the first thing would happen is that I'd probably say, ow. The second thing that would happen is my tissue structures would release a text message to my spinal cord, and that's called prostaglandins. That text message then goes to my spinal cord, and my spinal cord then releases something called substance P, another text message that then gets sent up to my brain going, I think we've got tissue damage. Okay. The amount of substance P and prostaglandins you have, the amount of text message reminders you get is correlated to the amount of pain that you get. And so what happens is in chronic pain, there are real physical changes that happen that you cannot help, but have nothing to do with the structure. What are they? You get better, as we practice something, there's nothing that you practice in life that you're not going to ultimately get a little bit better at. And it's the same thing with pain. So if I have pain in my knee and it continues to hurt me, my brain stem, my spinal cord gets better at producing text messages to let me know there's a problem. So what does that mean? Say you've had an ankle problem years ago. So your brain is used to receiving text messages about your ankle. Then you don't have ankle problem. And then you have another ankle problem. Your brain is kind of already conditioned to give you information about that bad ankle. So the next time you get ankle problems, it goes, oh, well, I've already got this far, I'm going to give you more information. And then if it happens again and again, you get just a trivial amount of injury. Now, will give you a lot of pain because your brain has become acclimated to receiving text messages about that insult. Whereas me, if I've not hurt my right ankle before, maybe I've hurt my left one, but not my right one, I have the same injury you do, and physiologically, I have less text messages to remind me. And that is the physiological nature of pain. It's you get better practiced, like you get at anything, at receiving information about a thing that happens most frequently. What's the best? And the other thing I want to say about inflammation is we think it's the devil. Okay, inflammation's the devil, I got to ice it. Wrong, it's not the devil. Because what you want to think about is any process that happens that biologically still exists with us, it happens for a reason. Otherwise, we wouldn't do it anymore. So if I roll on my ankle, it becomes swollen. We all run for the ice, ice, rest, elevation, compression. Is that what it is? Yeah, okay. Completely wrong. If you want to the swollen ankle to be less swollen, completely wrong. If you want the swollen ankle to be less swollen, okay, and in less pain, put ice on it. If you want it to heal, don't. I'll explain. So the inflammation is there to serve a purpose. It has a job to do. And the job is multifactorial. It's supposed to do a lot. So the first thing it wants to do is stretch the ligaments. Because when it stretches the ligaments, that stretch in the ligament called a Golgi tendon organ sends a message up to the spinal cord, and spinal cord goes, oh, there's a lot of stretch here. I'm going to tighten up the muscles to try and protect the joint. So that's the first thing that happens. Physical stretch stretches ligaments, and we all think that ligaments are attaching the ends of bones together. That's what structurally holds my bones together, but that's not true. They have a role to that, but the real role of ligaments is to contain the stretch receptors, the nerve endings that detect the amount of stretch going on in the ligament, so my muscles can actually understand, like an early warning system, how to contract or not around the joint. So that's the first thing. So when I have swelling, stretches the Golgi tendon organs, which then causes my muscles to tighten up to protect the joint, number one. Great, perfect. Next thing that happens, I get the release of prostaglandins, which is a text message up to my spinal cord to say, oh, I've got a problem, give me pain. Okay, and so what you think you want to do is put ice on it, which is a vasoconstrictor, constricts the blood vessels, limits how much inflammatory mediators can get to the site of the injury, so therefore limiting the amount of swelling and stretch that's going on so my muscles relax, and limiting the release of prostaglandins. Brilliant, it looks better and you're not in any pain. But think, in terms of evolution, we're walking around on I don't know, maybe 70 to 100,000 years old hardware. The purpose of inflammation isn't just to give me pain and cause my muscles to tighten up. The purpose of pain is to heal. And so all of the other mediators within inflammation that are there to signal the cells to heal get shut off too. So actually what you want to do is put heat on it. And heat will also reduce the pain. Why? Because heat and cold both ascend something called the spinothalamic tract, which is a nerve in your back, which also pain ascends, or pain information ascends that nerve. So if I give my brain information on temperature, hot or cold, doesn't matter, then it limits the bandwidth of my brain's ability to receive information on pain. So it's a little bit like if my kids are on like Netflix in one room and whatever, only 3 of them can go on Netflix at once, okay? And so if I load up all of the devices with just like documentaries, I have 3 different things on documentaries, they can't go on Netflix, they don't get anything. Same thing with pain. If you load up the information with heat or temperature, you ain't going to get no Netflix. You're not going to get any pain information, which is why it feels so nice in a bath when you're in pain. Pain's gone. Okay, and then you get out of the bath and you have way more pain and you're way more achy. Okay, it's the same thing. And that's actually why most of the medications, the ointments that you get from the pharmacy all have capsaicin in it, like heat. Because the pharmacist knows it's actually not doing anything other than temporarily giving the brain information on heat, so you experience less pain in that moment. Anyway, enough of that. Okay, so here's the solution. How do we help you? Like, how do we, if we suppose for a moment, and you absolutely don't have to agree with me, that what we're saying happens to be right, that pain after the point at which the structure is healed is now to do with the sensitivity of the nervous system, the brain. How do we, in some sense, rewire the brain in order that you experience less pain? That's the question, isn't it? I'll show you now. Okay, so if we go in here, this one here, so keep clicking. Another one, go again. Yes, this one here. Okay, I'm going to try and explain. Okay, so we're going to get a little bit kind of, what's the word, esoteric for a minute. Not too much, but kind of a little philosophical, is that the right word? Yeah, okay, we're going to get a little philosophical, not too much. Okay, we're going to do a little bit of thinking just for a moment. Okay, if we imagine for a moment, this is your brain, this is process, this is your brain. And so if I give you the question, what can your brain do? What would you say to me? Let's make it a bit more interactive. What can your brain do? Think, perfect. Anything else? Pardon? Perfect. Yeah, definitely can do that. I do that all the time. Yeah, definitely. Yeah. I'm terrible for deep thinking, obsessive thinking, awful for that. Yeah, definitely does that. What else can it do? Anyone else? Go on. Three more, and then I'll say what I think it does. 3 more. Go on. What can the brain do? I'll let you answer. Don't worry. Okay, so most people would say the reason why we've evolved to be the apex predator on the planet is our ability to problem solve. So that would be a big one. We can problem solve. And we have self-awareness, apparently, but then maybe animals do too. But we definitely can problem solve. And we can also express creativity, can't we? That's a big one. And we can multitask. And we can express love. And we can express hate, I suppose, and jealousy and envy and all of these kind of full expressions of the human kind of psyche. We can do all of those things, and we can philosophize. We can do like a Descartesian, I think, therefore I am kind of whole gig, if that was your thing. And I'd say you're completely right, 100% right. But let's go a little bit deeper and say, what can your brain actually do? Like, what can it do? Let's get really specific now. What can it do? And you're like, problem solve, multitask. I know, but what can it do? Think about it. It's locked inside a bony vault. It's like, what, 7, 8 pounds, something like that. In a real sense, it can't see anything. It can't hear anything. It can't feel anything. It can't taste anything. It's literally a jelly-like substance in your head. So what can it actually do? And it turns out it only can do two things, which is kind of cool. Okay, two things it can do. Number one, so this is your brain. Okay, what can it do? Number one, what it can do is it can organize the contraction of muscles. You're like, what? No, that doesn't seem sexy, like, thinking, creativity, muscle contraction, that's not cool. It can organize contraction of muscles. You have three types of muscle. You have cardiac muscle to pump blood around your body. You have smooth muscle to pump food around your tummy. And then you have skeletal muscle to move your eyes and your neck and your arms and your legs and your core and your pelvis and all of those things. And you're like, yeah, so what? Well, what I'm going to say to you is that muscles, in a very real sense, are the instrument with which you negotiate and navigate through the universe. And so if it wasn't for the vehicle of using muscles, you couldn't do anything, like nothing. So if I happen to have, I don't, a joke to tell you, I would use muscles in my voice box to do it. And then if I wanted to write something down to let you know that I had a unique idea, which I don't, then such that I could give it to you, I would use muscles to do it. So it turns out I cannot do actually anything at all without the action of muscles. And all of my expression of love and creativity and hope and humanity and problem solving and multitasking, everything has to be done through the conduit of muscles. Because without muscles, they are in a very real sense what, if you're a creationist, what God, if you're an evolutionist, Darwin, has given us to interact with the universe. Okay, I'll leave you with that thought. Second thing, because completeness, what's the other thing my brain can do is organize the secretion of stuff from glands. So the secretion of, let's say, cortisol, fight or flight hormone from my adrenal glands. Maybe, let's say, as I ingest my food, to convert that food in some sense to energy, I need insulin released from my pancreas. Okay, so my brain can organize the secretion of stuff from glands. Does that make sense? Brilliant. Okay. What else? How does my brain do it? How does my brain know which muscles to contract and when? Well, that's a combination of things. It's a fusion of things, and this is probably the easiest way to say it. So my brain gathers information. My brain gathers information from nerve endings embedded throughout my body. Okay, every single tissue structure in my body has nerve endings that tell my brain information. What information? Things like hot and cold and deep pressure and light pressure and stretch and contraction. All of those things. All of those things get sent constantly up to my brain, together with, and then that gets mixed with how I learned to do it when I was 6 months or 9 months or 12 months. Together with my emotional state at the time and how I feel about it and whether I actually recognize that the thing's been previously injured or injured 15 years ago and I still think it's weak. And then my brain spits out a movement solution based on how I'm feeling right now, based on the information coming from the leg, if it's a leg problem, and based on my fears of re-injury. And then my brain goes, okay, that's how it's going to operate. And not only is that how it's going to operate, this is the amount of pain that I'm going to give you associated with that. Wild stuff for a Thursday. Alrighty. So most therapies that you will have come across try to treat you here. Okay, so what they'll do is you'll go into them and they'll be like, how many of you been to like chiropractor, physio, osteopath, anyone? Okay, a couple of people. So what they'll do is they'll assess you and they go, oh, Mr. Jones. Don't know why it's always Mr. Jones, but it seems to be. I'm not chauvinist, by the way. We'll say Mrs. Jones. That's absolutely fine too. Okay, Mrs. Jones, your spine is a little tight here and these joints aren't working here. So what I'm going to do is manipulate the joint. I'm going to massage the muscles and I'm going to try and relax it down. Brilliant. You feel amazing. I could go through the pathophysiology and the neurology of why you feel amazing, but you feel amazing. Maybe by the time you get to the car, maybe about a week later, it tightens up again. You go like, oh, what, man? Why is that happening? Generally. And the reason why it's happening is because your brain still thinks you're injured. And is it going to tighten up the muscles, tighten up the joints to try and protect you? Why would it do anything else? Why would it do anything? So you haven't changed your belief system. You haven't changed the sensitized information coming up from the leg. So the brain's going to tighten you up. Like, think about it. If I have a tight muscle here, okay, and I stretch it, it's going to help. But if it tightens up again, maybe I'll stretch it again. But sooner or later, if it keeps tightening up, you've got to at least think, well, why is it still tightening up? And the reason why it's tight is because your brain wants it to be tight. So there's a couple of things that you can do, and there's a couple of things that we can do. But in a nutshell, how to get you better is really simple. It's not hard. It's about identifying the faulty information, identifying the reason why your brain believes you need to be like you are. Because if you don't identify that information, guess what? It's always going to give you the same outcome. Because what you really need to understand about chronic pain is that your brain has decided that you have to be like that because it wants to protect you. It's the solution your brain has come up with based on the synthesis of information it's receiving, both from your body and your belief system. And unless those things change, you're always going to get the same thing. So my point is, what's happening with you is that your back is not the bad guy. And any intervention trying to treat the back is going to temporarily calm down the back for sure. But then you've got no choice. You're going to have to overuse the back again. And so you're going to be in chronic back pain. Like low level, for sure, but constant irritation. You know, most likely with you, walking around isn't so bad, but heaven forbid you stand at a gig or stand still for a period of time, you're pushing your pelvis forwards, creating more of an acute angle, causing irritation, inflammation, and standing up for a period of time is just never going to happen for you. It's the worst thing. And that's the reality, is that you are doing, and you might say, okay, well, that's posture. But it kind of is. But if you unpick what posture is the solution your brain has come up with based on all of the previous traumas it has, all of the sensitivities that your nervous system has, together with your belief system, is the then summation of that to where the best place that your brain feels that you should be. So how do we get patients better? That's the most important thing, isn't it? And that's really, really simple. What we want to do is we don't want to focus on the good guy, okay, which is your back. Because unless we figure out all the stuff that ain't working, okay, it's going to constantly be overused. And we can rub and massage and click it and all that good stuff forever. What we want to do is identify all the stuff that ain't working and get it working again to allow organically the back to relax. Now, I'm not saying there's not an injury, and I'm not saying there's not arthritis, and I'm not saying there's not a disc injury. What I'm saying to you is, based on the preponderance of evidence, that isn't going to be the problem. The problem is it's chronically inflamed because it's irritated all the time. So the reason why it's not got better is it's chronically inflamed and overworking, and probably now a little bit injured, soft tissue injury. And the reason, and what you do is you constantly re-injure it. It's not that you suffered a catastrophic injury 15 years ago that's never recovered, it's you just constantly overuse and re-injure it. And so it's a case of getting all the other stuff working, get this guy to relax, allow a reasonable time for the inflammation to die down, and then what? When we figured out everything is working, we need to start to get you moving. Movement is key. Movement in the brain is so important because think about it. If of those of you who've had children, you get a red book, and for the first 4 years, to identify whether a child is doing okay, we assess that child against movement, not intellect. Because movement is most foundational. Because if the child can move correctly, then we know that at least those formative reflexes are starting to develop in a normal way. So movement is more important in a lot of ways. And that's why the brain is wired for movement, which is why your brain can only do two things: move muscles and secrete hormones anyway. So how do we get patients better? There's a saying in neurology: movement is inversely proportional to pain. If the brain is receiving lots of beautiful information about complicated, adaptive, novel, strange movements, the brain is going, wow, okay, yeah, there can't be too much of a reason why I'm going to give you pain because you're doing all this crazy new movement. And then when you can move pain-free and the brain isn't tightening you up and spasming muscles to protect you, then what? Then you need to strengthen everything up. Then you bulletproof yourself by applying strength. The problem is most people try to do movement and strength first. So they're like, oh, I got a bad back, I'm going to move more. Well, great. You're doing the right thing, but in the wrong order, because your brain is still going to tighten up your back to try and protect you because you're working off a buggy software system. Your brain is still going to try and protect you, so you're going to do the exercise brilliantly and probably even get better at doing it, but your back is going to get worse. It's like everyone who goes to yoga and Pilates, they go to yoga and Pilates for a specific problem, start at the basic class, go into the intermediate, and they even get to the advanced, and they're like, oh yeah, but how's your neck doing? That's why they're no better. Of course. So lots of novel movements there. Oh, before I forget, we've obviously done this presentation. It's not that practice, but I've done this before. There is a data packet that we send out for lots of movements to support you so you understand that. I'm going to send it to Louise. If Louise approves it, then you'll get that and you'll get all our movements and kind of things that you can routinely go through. All right, don't worry about that. Just kind of fast forward. The most important thing is to understand pain. Either you have a problem that is like, oh man, you have a problem and you need surgery, or you don't. And if you don't, the problem that you have is your brain is acting in your best interest based on the information it's receiving from your body to try to protect you. Keep going. We're going to ignore that. Yeah, okay. I think we're going to be running out of time soon, so I think that's probably enough in terms of presentation. What we were just going to go on to talk about is different types of movements and strength training. But strength training is probably the last thing that I'll talk about. And so what you need to understand is, like with your back here, your back is injured, it's inflamed, it's irritated, lots of soft tissue structures, constant re-injury, constant irritation. And so, yeah, you have a soft tissue structure. No one would deny that you didn't. But the problem is that any exercise that you do is going to constantly irritate it because that's the way you've learned to do it. And so once we've figured out how to stop you using your back so much and allow all the other systems to work normally, how do we then transition you to bulletproof you to make you more resilient so it doesn't happen again? Or strength training. And there's a couple of things to say, particularly with low back about strength training. It kind of sucks, but it's true that one of the quickest muscles in the entire body to waste away, atrophy, is the little muscles in between the spine. Because most people think, and they're wrong, and respectfully, but it's just a truth, that, oh, my back is really tight and it's achy, I need to go and see the chiropractor, physio, osteopath, and I want a manipulation to calm it down. But what you need to think about is, why is my back tight in the first place? And so very often the reason for the back being tight is not because it's too tight and you need to relax it. It's because the little muscles in between the spine, you have 139 joints in the spine, lots of little muscles that are supposed to provide stability so you can move like a snake. Those little muscles waste away very quickly. And so what happens is the bigger muscles kick in to try to protect you. And so then if you have a manipulation and a massage to calm down the big muscles, you've basically left yourself with nothing. That's not good. So what you want to do is go through a lot of guided exercise to build up the little muscles. And when you have sufficient strength in the little muscles, the bigger muscles can relax. But that's tricky because they atrophy very quickly. And so what you need to do is you need to figure out, we figure out with you, how much exercise, how much loading you can tolerate in your back. And then what you, like the maximum before you start to, your nervous system feels threatened and tightens up your back again. So how much exercise can you tolerate? And then what you want to do is titrate underneath that by about 30%. And then that's the zone that you work in. So you train enough that it creates change, but not so much that it causes injury or a flare-up. And then maybe a month or two later, you turn up the volume on that a little bit until you can do whatever the hell you want to and you have strength. Brilliant. I think that's about all for me. Any questions?